Assalamualaikum doctors. In this video, I am discussing how can we take the history hypoglycemia. So hypoglycemia, the task is that scenario 2-year child with fainting attack. So history or present illness we analysis like before, during and after. Very important. Hypoglycemia sometimes not eating food. So before, during, after. Was it the first time to occur or recurrent? If recurrent, when was the first attack? What did you do when it occurred? Precipitated by any fever or illness? Fasting over the night or infrequent feeding. So again, we are asking before, during and after. Was it the first time or to occur or recurrent? If recurrent, when was the first attack? What did you do when it occurred? Precipitated by any fever or illness? Fasting overnight or infrequent feeding? The nutritional history brought earlier. That tell me more about his feeding. Is he breastfeed or formula feed? What type of formula? How are you feeding him? Who prepares the bottle? How many times? How much is he taking every time? Did you start weaning? Are you giving supplementation? So nutritional history like that. Tell me more about his feeding. Is he breastfeed or formula feed? What type of formula? So how are you feeding him? Who prepares the bottle? How many times? How much is he taking every time? Did you start weaning? Are you giving supplementations? General about the weight loss, change in appetite, daily activity and sleep, and any chronic conditions, unusual facial features, large tongue, midline defects. So large tongue, Beckwith Whiteman syndrome associated with hypoglycemia. We search this. Review the system one by one. GIT, increased tummy size like hepatomegaly, tummy pain, loose poo, throwing up, oral soreness, lips cracked, anal soreness and yellow eye. Endocrine about the thyroid, hot intolerance, diabetes mellitus. Did you measure blood glucose before? Serious about the feet, loss of consciousness, unusual movement, sudden change in mood, unusual crying, morning vomiting, deviation of the face, eyes, red eye and eye cloudiness. Ears about the large increased concern about vision and hearing or speech. Okay. CVS about the racing of heartbeats, fainting episode and sweating during feeding. Hematology is pallor, bleeding, bruising and recurrent bugs. Urinary about the pee color, amount, painful peeing, recurrent bugs, froth urine, urine dipstick. Genitalia about the private parts, appearance and blood pressure measured. Chest, rapid any breathing, coughs and cold, runny nose, nasal discharge, chest pain, noisy breathing and recurrent chest bugs. MSK about the skin spots or pigmentation, swollen neck glands, lumps, bone pain, painful joints, bluish discoloration of the gums or nails and changes in hair and nails. Past history 5T IOA, previous hospital admission, team, trauma, traveling history, surgery, parental history, jelly scan in pregnancy, liver, birth weight, newborn heel, blood spot test, any abnormality, newborn examinations, neonatal hypoglycemia for BWS, prolonged neonatal jaundice, NIQ admissions. Development is gross motor, fine motor, social, speech and growth chart. Vaccination up to date, extra shots, allergy to certain foods or drugs, family about the consanguinity, family history of similar condition or any inherited diseases, previous sudden infant death, are you living together, do you have other siblings, possible child access to medicines or alcohol, oral hypoglycemic agents, alcohol, aspirin, beta blockers and insulin, social, financial and home and psychological impact. That is how can we take the hypoglycemia history. Differential diagnosis of hypoglycemia are, first of all, inadequate glucose or intake or production or excessive glucose consumptions. Okay. So the most common cause of hypoglycemia is ketotic hypoglycemia during periods of fasting and illness. So ketotic hypoglycemia will be our first. Ketotic hypoglycemia. But endocrine and metabolic causes should be excluded first. Ketotic hypoglycemia, decreased glucose, undetectable insulin, increased non-esterified fatty acid, increased beta-hydroxybutyrate. During a period of fasting or intercurrent illness, malnutrition, malabsorption and sepsis. Growth hormone deficiency, cortisol deficiency and glycogen storage disease causes ketotic hypoglycemia. So our diagnosis is ketotic hypoglycemia. Metabolic causes of we can tell DD. So metabolic causes of hypoglycemia are glycogen storage disease, commonly type 1 glucose 6-phosphate deficiency, galactosemia, hereditary fructose intolerance, fatty acid oxidation defect, commonly MCAD, defects in amino acid and organic acid metabolism. Endocrine causes are number 1 hyperinsulinism, that is decreased glucose, increased insulin, decreased non-esterified fatty acids, decreased beta-hydroxybutyrate. Congenital are genetic defect in the genes that regulate insulin secretions. Transient is infant of diabetic mother, maternal beta blockers, hypothermia, IUGR and birth asphyxia. Exogenous are accidental injections, non-accidental these are the neoplastic are insulin producing tumor, adrenal insufficiency, primary Addison's disease, congenital adrenal hyperplasia, secondary ACTH deficiency or part of hypopituitarism, trauma, tumor, infections, growth hormone deficiency and hypothyroidism. Some syndrome we keeps in your mind, keeps our mind when you take the history. Beckwith-Whiteman syndrome, hyperinsulinism, subtopic dysplasia, and hypopituitarism. Hepatic cause are hepatitis, cirrhosis, race syndrome. Drugs and toxins are aspirin, alcohol, insulin, oral hypoglycemics, valproates, and beta blockers. So this is hypoglycemia history and the differential diagnosis. These are ketotic hypoglycemia, metabolic cause, any syndromic features, and any endocrinal cause like hyperinsulinism, any drug and toxins causes hypoglycemia. Thank you.